You're listening to episode 68 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness teachers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Dr. Daniel Cherkin speaks with us today about mindfulness programs' impact on back pain. We've seen a great deal of research about mindfulness these days, and in lots of arenas, including pain management. Much of that research is done by those with an interest in mindfulness. That's what they study. But today's guest speaks from the position of a researcher who does not have a vested interest in mindfulness or contemplative practice at all, and what he found in his randomized clinical trial for mindfulness effects on patients suffering from back pain. Appointed December 2010 by Health and Human Services Secretary Kathleen Sebelius, Dr. Cherkin served on the 2011 through 2014 National Advisory Council for the National Center for Complementary and Alternative Medicine within the National Institute of Health. He was appointed to the Patient-Centered Outcomes Research Institute's Advisory Panel for Improving Healthcare Systems Advisory Panel in 2013. Dr. Cherkin has maintained 2 faculty appointments at the University of Washington since the 1980s and is now affiliate professor in both family medicine and health services. Special thanks to Rebecca Hughes for her coordination of today's interview. Our guest today is Dr. Daniel Cherkin. Dan, thanks for joining us.
Nice to be here.
So before we get started talking about the research itself that we're here to discuss on mindfulness and back pain, tell us a little bit about your background.
I was trained in a variety of research methods, mostly biostatistics, health services research, and I have applied that to practical problems like how to improve care for back pain.
Excellent. And tell us about Group Health Research Institute.
The Group Health Research Institute is approximately 35 years old. We have over 300 employees, about 60 researcher leaders who do research on a variety of relatively common problems that face Americans and healthcare systems and clinicians, such as diabetes and depression and chronic pain in general, and aging, and a whole host of other common issues.
So what I find interesting about that is that, just to confirm, you're not a mindfulness organization. You don't do exclusively mindfulness research.
We like to think of ourselves as a mindful organization, but we're definitely not a mindfulness organization.
Wonderful, thank you. So what first attracted you then to studying mindfulness impact on back pain?
Well, that derived out of 30 years of research evaluating different approaches to improving care for back pain, particularly focused in primary care. And we have studied things like physical therapy, patient education, physician education. More recently, we've done a number of randomized trials evaluating so-called complementary and alternative therapies like acupuncture, chiropractic, massage, and yoga. And it seemed as though the time was ripe to try to study something a little bit different, an approach to back pain that focused on treating the mind or the body through the mind, if you will. And so MBSR is something that we've been aware of for a long time, and that has been increasingly popular nationally, probably internationally. And so we were able to get funding from NIH to study mindfulness-based stress reduction, which is one of the most common approaches, mindfulness approaches to chronic health conditions.
So what did you do for the study? Did you use MBSR as the intervention?
Yes, what we did is we compared MBSR, mindfulness-based stress reduction, with a existing approach that cognitive behavioral therapy, for which there was already a fair amount of evidence that it was effective for chronic back pain and for chronic pain in general. And so we wanted to compare mindfulness-based stress reduction with this already proven effective approach, cognitive behavioral therapy, as well as with a group that just did not receive any particular intervention. So it was all the participants in our trial continued to seek and receive whatever care they wanted for their back pain. And in addition, those receiving mindfulness or cognitive behavioral therapy received those treatments.
And how did they compare? What did you find?
We found that, first of all, that mindfulness-based stress reduction was an effective treatment for chronic back pain, that the effects, the benefits in terms of improved functioning and decreased pain were evident after the 8-week treatment period, and that the benefits persisted through 1 year after entering the study. And in fact, we found surprisingly that the benefits did not decrease between 6 months and 1 year, as is typical of most treatments for back pain. We also found that mindfulness-based stress reduction was comparable to cognitive behavioral therapy in every way that on every outcome that we compared them, really. So basically this suggests that not only is mindfulness based stress reduction effective treatment, but that its effects are equivalent, similar to those of cognitive behavioral therapy, and that the effects are long-lasting, or at least to 1 year.
And was that a little bit different from what you found with CBT? Were the effects equally as long for that?
The effects were not significantly different. One can do a study and find a little bit of a difference here and there, but those are often just by chance. So I'd say that what we found was that mindfulness was effective. Its effects lasted longer than some might have expected, that is at least 1 year, and that all our evidence suggests that mindfulness-based stress reduction and cognitive behavioral therapy are comparable.
And why do you feel this is important research? What is it that intrigues you most about this?
Well, I think it opens the idea of to different approaches to something that's been often treated as a largely physical problem that required physical solutions. And I think there's been increasing awareness in the chronic pain community of practitioners and researchers that the mind plays an important part in that, even if it's not something that could be described as it's all in your mind. The mind is something that affects, processes everything that goes on in the body, and it interprets it, and then therefore it gives certain types of meaning to the chronic pain experience. So chronic pain is definitely a physical problem in the sense that it affects the body through pain signals and impact on functioning. But the mind is also an important part of that. And in fact, I'd say the mind and the body are really part of the same human experience because they are all reside in the brain, are all processed through the brain. So I believe that this study, as well as others that have found mind approaches like MBSR for other health conditions or CBT to be effective, I think these studies really suggests that we should really be more open to the mind aspects and not just focus largely on the body.
And Daniel, is there any other anticipated use of perhaps mindfulness programming for other problems that people have that the Group Health Research Institute is contemplating that you might be able to share?
Actually, as you pointed out, when we're not really focusing on mindfulness here. We were focusing on different treatments for back pain in this case. But I think the fact that we had these positive results with chronic back pain and that the benefits of mindfulness lasted for a while is getting attention here at Group Health, both in our research institute as well as in the healthcare delivery system. We've known for some time of studies that have benefited clinicians who were highly stressed. There was a study actually in JAMA some years ago that a continuing medical education mindfulness training helped reduce stress and a sense of burnout and increased compassion. So I think there's all kinds of opportunities for applying the results that we and others have found showing the benefits of mindfulness to a wide range of human experience, both applying to the pain and suffering of patients, but also to the stresses and suffering of clinicians who are doing their best to take care of those patients.
Glad to hear that you'll be looking into that. Our guest today, Dr. Daniel Cherkin. You can find out more about his work at grouphealthresearch.org. And please do check out the episode page for this episode. I'll have a number of other links pertinent to this particular research. Dan, thanks so much for being here.
My pleasure.
Thanks for listening. If you'd like to learn more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.